hygiene. How many of you have extracted a tooth, had the patient go for the implant to the oral surgeon, had perio surgery, and you see them and it's like grunge mouth? They think that's an excuse to put away their toothbrush. And the oral surgeon, maybe the periodontist, maybe, or let's talk about patients going to ortho, little kids, these young kids who hygiene's always an issue, okay? They don't want to irritate the area when they're cleaning. Well, Armor Dental, which is MouthMate, Cherie is here with her husband David. I like that these really nice looking women bring their own bodyguards with them. I mean, I think that's pretty cool. But you've seen these areas where they're painful to brush. Imagine a fresh wound and you're going over it with even a soft bristle toothbrush. It's going to hurt the patient, going to tear the stitches, and potentially rip out the stitches and cause bleeding. Patients dread brushing near the surgery site. So how do we improve the outcome for better hygiene? Compliance with home care is, what are the three biggest problems with at-home bleaching? Compliance, compliance, and compliance. The same is true with brushing. You may tell them to brush, but they may not comply. So how do we improve this? Well, Cherie has come out with a rather unique and clever, easy-to-use system for the patient. They have what I call three different kinds. They have a U-shape, which fits over the socket size, and they have a small one and a large one. They have a circular one, which is ideal over canker-sore areas. How many of your patients have come with canker-sores and they're afraid to brush in that area, which can only make things worse with plaque buildup? Or if you're doing a biopsy or have braces, I find that this one works very well as also. So what you're going to do is simply place, in this case, that U-shape over the area, ask them to hold it with their non-dominant hand. Okay, so I'm a lefty. So I would put it on the extraction site, and then I take my toothbrush and I brush right around the MouthMate. Now, the interesting thing is reminding or telling patients to take it out after they brush that quadrant. Because, when I first did this, patients, even though I went through the instructions, they said, yeah, but it's really awkward holding it there and brushing the rest of your mouth. Well, idiot, take it out, okay? I find that if you wait about 3 days and have them start doing it after the third day, you're better off, okay? They're more receptive to that. Somehow they get it better. But the features, you see how it just goes over that area and protects it? It's very, very nice. By the way, they're inexpensive. I give them to the patients. You can charge them. Cherie, they're roughly about $5 an instrument. Yeah, and they have this gooseneck flexible attachment, so any configuration, up, down, right, left, whatever. It works really well. It's very secure. The tip's not coming off, and they can hold it. And you see, non-dominant hand and come in, whether it's an electric toothbrush or a regular toothbrush. But you've protected the site. You protected the site. So I think it's a valuable tool to use.
She's going to demonstrate how she can place the armor shield over the extracted and well-grafted site and brush the adjacent teeth without disturbing the site or causing any pain to the site of the surgery.
And you just rinse these out. I mean, it's no big thing. Okay, not a lot involved with this. Top or bottom, where you do tissue grafts, if you're doing any grafting, you hold that over the graft site so there's no disruption, and you brush all around it. So it works pretty good in that sense. Okay, here you see in different directions you can hold it. It works well. Patients seem to like it. So Cherie's got different sizes. You buy boxes of each size, and you keep them depending on the issue. Like if I'm doing operculectomies, personally, I like that one for the operculectomy. Okay, if I'm doing a frenectomy, pretty much small, I'll still stick the circle. I stock usually the U-shape and the oval, the circle rather, not the oval. That just because of what I'm doing in the office, and they work very, very well. That's Cherie's number, her email, but you have the benefit of Cherie's right here in the room, and she's going to do something special for a meeting special. Cherie, what are you going to do? Samples for everybody. There you go. Drinks on, no, just samples on the sample MouthMates for everybody. try it. I mean, take a patient next time when you're back in the office and try it. I think you'll get a good result. Roy, you've had good results with this as well.
I use it on all my implant cases. I don't immediately load. I'll put it over. Patients love it. The only objection that I have, and Cherie, I don't know if I spoke to you about it, is that there is a small learning curve. Woman called me up, she said, I have it, I can't, I'm having difficulty placing it with one hand and brushing with the other. But it's a small learning curve, a day or two doing it. But it's has excellent utility. Graft sites, implant placement, extraction sites, super. I don't know why I didn't think of it.
Yeah, isn't it, you know?
Yeah.
Damn it, Cherie. You were ahead of the curve on this one. Any questions on that? Yes?
Your purpose is to just give this to somebody that you.
In my office, I'm giving it to them.
Yeah, I give it as well. I give it as well.
Yeah,
Cost me $5, big deal. You're a hero.
So that's roughly your cost per unit. It's like-
That is the cost per unit, yeah.
Yep.
I mean, I'm sure there's some volume pricing. If you bought, 3 train loads, she'll be happy to discount it for you, but yeah, I give it out. If you're worried about it, add $5. I mean, I'm not in retail, so I don't like selling stuff to patients.
Yeah, most of our offices are just holding the cost of the procedure.
Yeah, folding it in, I think that's the way, but I think it's great. I've got, I'm trying to get my surgeon to be more receptive to this, so either he gives it to them or and then I don't have to stock it.
Look, the reality is, if you're placing an implant, charging the patient $1,500, whatever, that's what I charge for implant placement, or $750 for a bone graft, do I care? I mean, on a cost basis, what's my real cost for implant placement or bone graft?
But you're a hero.
And you give it to them, you are a hero.
And not only you're a hero to them, but you're a hero to yourself. You know why? Tissue's gonna look a lot better when it comes back, because they maintain their hygiene.
I gladly give up $5 for a predictable outcome.
Yeah. So it works, the stuff works. Just the dates to remind you, next year, the dates are one day